Which brings me on to my next guest and Narayana Healthcare. They've got the latest win. They've received a health insurance license. So let's chat a little bit more about that. We've got Mr. Devi Prasad Shetty himself joining in on the show right now. Dr. Shetty, great to have you today on the show. Thank you so much for taking the time out. Tell us about this new license now for insurance. You've got it within 6 months of submitting the application. Did you anticipate that? How is it that you're going to manage healthcare insurance? And how different would it be from the regular health insurance that we all take up?
First of all, I want to thank IRDA for the remarkable speed at which they have cleared our license. It used to earlier take over 1 to 1.5 years, more than the waiting period. They would never, around many years ago, I tried to see whether I can apply for a license. And I didn't even get a chance to talk to them. Things have changed in IRDA. It is run by very dynamic, very progressive people. So we got it in less than 5 months, not 6 months, less than 5 months. I think it is the fastest health insurance license anyone has got, thanks to them. But it's an exciting opportunity, and this is the only way we can transform Indian healthcare. This is the way forward, I have no doubt. We should start talking about not universal healthcare for free for the citizens with the taxpayers' money. We should talk about universal health insurance for everyone. This should be our slogan.
And it's much needed as well, right? And I stand corrected on 6 months. You're saying it's less than 5 months that you got the license. But to the point that I was, making earlier, how is it going to be different from the other health insurance schemes that are available?
See, currently the health insurance companies they work like a financial intermediary, which you get admitted to the hospital, you produce a bill and they pay the money. We want to be different. We want to be like a managed care organization, like a Kaiser Permanente of US, wherein we evaluate all the members, we have all their data with us, we manage their primary care, we manage their secondary, tertiary care. And we would like to predominantly work like custodians of healthcare rather than just a payer for the treatment. We want to know the status of the healthcare. If there is a diabetic patient, we are not going to refuse care. We will offer them the care, but we will ensure or help the person, hand-holding them and making sure that diabetes is controlled. Essentially, we want to ensure that people do not fall sick. Then the conflict of interest will be addressed. Today, about 16-17% of the heart surgery done in India is done by us. Today, we have no incentive in preventing people from falling sick. Once we become a health insurance company, it is better for us if people don't develop a heart attack. So the whole problem of conflict of interest is addressed. This is the way we want to move forward.
Well, I hope that aim is achieved. But tell me, by when are you looking at beginning the operations when it comes to insurance? Considering that you've got your license itself at breakneck speed, when do we see you get going? And which geography would you target first?
Yeah, our team is all set, and they are hopeful that with next month itself, we'll be launching our products. And we initially want to concentrate on city of Bangalore. Then we would like to look at Calcutta, where we have a large presence. So we are not going to cover, it's not going to be a pan-Indian insurance company from day one. We want to do it in a gradual manner. We want to learn. We want to make all the mistakes at an early stage when we are small, learn from it, then progress.
Fair enough. Morning, and I wanted to ask whether or not there is going to be a correlation between your hospitals and the insurance company?
Yes, there is a major correlation. Definitely. This is the advantage of hospital becoming a health insurance company, wherein there will be a lot of benefits our members will enjoy because we are a healthcare providers. So a lot of benefits they get in terms of having access to us around the clock. And we have hospitals across the country, and we have large number of nurses who are extremely well trained, and our services are available to our clients around the clock. Yeah, there are many benefits.
And given that insurance companies are, demanding a hospital regulator, I don't think hospitals are in favor of that. Can you just tell us as to, what the stance is, the latest stance is on this?
See, essentially, I'm not saying that today we have a very interesting scenario wherein there are three stakeholders in healthcare. We have hospitals, we have health insurance companies, we have patients. And there is no trust between these three important stakeholders. So I'm not saying who's right and wrong. I guess everyone is wrong and everyone is right in their own way. But current the relationship equation is not conducive for a healthy growth. So it has to change. And there are many things insurance companies are trying to do. There are many things hospital service providers like us are trying to do. So there is no one solution. There are multiple solutions. And we are thinking of one solution. Maybe we walk in this path and see over a period of time, we will know who's right and who's wrong.
The other thing, Dr. Shetty, I wanted to understand is, cost of treatment is going up and exclusions by insurance companies is also increasing. I mean, the key thing for early health insurance is that you've got to be hospitalized for at least 2 days to get that claim back. How different are you going to be with your health insurance, catering? Because I mean, for instance, even angioplasty, MRIs as well cost, even though the patients are not hospitalized for the same.
See, as I said, since we are going to offer primary, secondary, and tertiary care, we are going to take care of every aspect of healthcare. But one thing for sure, we are not. I wouldn't be able to give you the minor details because I do not have the access to that information yet. But all I want to say is that the moment we give you a health insurance, you are covered for everything from day one. There is nothing like a cooling period of 1 year, 2 years, none of those sort. So we will be covering everything. We'll be covering the outpatient, with our outpatient program. We'll be covering inpatient services. And when patients come to our hospital for the treatment, there won't be any co-payment. This is the plan our team has. Yeah. It's going to be dramatically different than what is available today.
All right. Appreciate your time. Thank you for joining in and giving us a view on now how you're looking at insurance as well being weaved in to Narayana Health with that insurance license.